I'm coming. Here we go. Oh, there you
So we're back?
go. Yes. I was like, no.
Where'd it
I
go?
don't know. That's
But
why I saved that
you'll
first
have
part.
two lives. You'll have two
It's
lives up in
fine.
your feed. So
Oh no,
okay.
we'll put it together. Don't
Got
even
it.
worry about that.
I don't even know what I was running my mouth about something. So
No, oh, we were just talking about grief and how like something goes on. I was saying that the death of my
um,
father,
yes.
like just grief at this stage in life, right?
Mm,
It's horrible for at any age, but
yeah.
but at this age, it's so
Mm,
it's aggressive,
yeah.
right?
It can feel more complex because there's so much other stuff, right, that you're also managing and trying to make sense of. Like I said, you didn't even know that you were navigating that particular transition, right? But you knew you were feeling grief and all these other things are happening. And sometimes we can't even tell it apart. Is this grief or is this something else?
And
You just know that your body is having all these different, really painful experiences.
well, and having those experiences, and there's so many things going on at one time. I mean, literally, um, yeah, my husband had his heart transplant 43 days before my dad died,
Mm-hmm.
right?
Mm-hmm.
So I'm
Mm-hmm.
caring for him, right?
And uh,
And the doctors are telling him, you can't leave, you can't get on a plane. He was like,
mm,
yeah, okay. We're burying my father-in-law. We're doing that, right? And
mm-hmm.
and
I'm
but
gonna make my way there.
we're
Yeah.
doing it, right? We're getting on the plane. We'll sit in first class. It'll be fine. We don't care, right? But I guess I'm asking you, like, at this phase in our life,
Mm-hmm.
right? Grief hits differently.
Mm,
And could that be also because we're looking at our own like mortality also?
yeah, there could be a number of different reasons, right? So one, remember we're also you're navigating hormonal changes at that time, right? So even
Yeah.
the ways in which we think and kind of process information is also different when we lose estrogen, when we lose progesterone, right? Because it's affecting our neurotransmitters, right? So you might have had this same experience years before, and your body literally would not metabolize it in the same way because your hormones are in a totally different position now. Right. So that's
Okay.
one thing that could be a remarkable change, right? My body is interpreting and holding this information very, very different than it would have because of the state of my hormones. Right. There's this other piece about just where it sounds like what you're getting curious about is just where I am even, psychologically. Like what do I find myself thinking of, right? And when there is loss in that particular phase of life, there could be a lot more reflection on your own mortality in a way that a 22-year-old might not be reflecting on their own mortality,
Right.
right? Right. So it
Right.
brings up kind of where you are developmentally, right? That can get activated and tapped on. It also depends on your relationship with loss. If there's been other loss, this is also going to feel more complicated and possibly more complex. If there's been recent loss, this is going to feel more complicated and complex, right? Because you are wading through murkier waters of a number of other things going on with you, right? It doesn't have to be lost by other losses that you might be navigating around the same time. It doesn't even have to be lost by death. It could be lost by transition. It could be loss of a friendship, and you're going to process this loss very differently, right? So it also depends on where you are socially. It depends on where you are relationally, like what kind of support do I have during this time? Again, if I am more isolated when I'm experiencing loss, my body's going to metabolize this loss differently because it's just me and me. There's no external kind of processing in that way, right? So there's so many factors, right, that would be unique to any person in certain circumstance that would tell the story of why they might be processing something in a certain way. What else is going on with you? What's going on internally? What support do you have around this? What do you understand, right, about this loss and the meaningfulness of this relationship? All of that factors into why you might be grieving the way in which you are grieving. It doesn't mean that you are grieving wrong, but you are grieving the way
Right.
in which you're grieving because of a number of these factors. There's something that counting the days gives you. I would get curious about that. What does that mean for you to stay on top of the days?
Yeah,
That's rhetorical. You don't have to answer. I'm just saying
yeah.
like those would be things like if I was working with you to like reflect on. There's something that feels important for you about the days.
Hmm.
You can get curious about what that is.
So okay, so like with all of this, right? We like I feel like the one thing
Mm-hmm.
that we hit on is loss and
Mm-hmm.
grief. I do
Mm-hmm.
like I feel like that is a what do you call it? Something
Theme
static.
or mm,
Yeah,
mm-hmm,
it feels like it's like this cord that's through
mm-hmm,
everything,
mm-hmm.
right? Uh, that everything we do is tied to some kind of, like, it feels like it, like
It feels like
something
it.
you perceive, something you perceive to be losing, right? And
Mm-hmm.
or you don't, right, or that you don't want to
That you
lose,
don't want
right?
to lose.
Um,
Yeah, yeah. That's
but
why they say
so how,
loss is a part of life. Loss is a part of life. We're not taught that. Loss is a part of all parts of our lifespan. We are not taught that. We're actually pretty protected and sheltered from loss. We don't take children to funeral. Like we do all this stuff to protect people from loss, which actually doesn't give us tools and resources when we're younger to manage inevitable loss that will happen.
it's interesting that you say that. When my husband waited 5 months in the hospital for a heart at Emory, and he used to
Mm-hmm.
say to me every day,
Mm-hmm.
God did not promise me to get out of here.
Mm-hmm.
So I need you, right, to understand that. That
Mm-hmm.
do I believe I'm going to get well? Yes, but it
Mm-hmm.
doesn't mean that I will, right?
Mm-hmm.
And I'm okay with that.
Mm-hmm.
And I don't know how I navigated that,
Yeah. Yeah.
right? And so because he made me feel, and made me feel almost okay with it.
Okay. He was trying to offer you that, but he was offering you a bit of this like gentle confrontation of you've got to look at your own relationship with loss. Now, I'm telling you my relationship with loss. You got
And
to look
almost saying
at
that you're
yours.
responsible for, there it is again. See? Oh my God, you're so good. You're so good. Okay, so in closing, like, so how do we, during this roller coaster of like
Mm-hmm.
perimenopause,
Mm-hmm.
menopause, and the like, right? How are we thriving? Because there's so many things that are
Mm-hmm.
happening. The loss of parents, the loss of
Mm-hmm.
the hormones, which is then triggering all these other things, right?
Yeah.
How are we really and truly thriving?
Mm-hmm. Well, I'll name two things that you are already accessing and navigating and offering and creating, right? Information and community are extremely, extremely important, right? When we have a sense, it doesn't mean that we know every little bitty kind of piece of it, but when we have a sense of what is going on, our brains like that. Our brains like to know what is going on. Our brains love guarantees, right? This is why anxiety is very, very, very real. Our brains love and have this demand to know what is going on and this demand for like predictability. So when we have access to more information about what even might be happening to us, sometimes it can feel pretty soothing. Depending on what's going on with you, sometimes that creates a rabbit hole, right? But we're searching for information, right? So information is really important, whether that is more generalized information or whether that is information that feels like, oh, this is literally me. Information is important. Community is important. People to talk to about these things, people to get curious about with these things. And by community, I don't only mean friends or peers, right? Community can also be people who you don't know, like the event on Sunday, right? You see the vulnerability that was in that room, and a lot of people didn't know each other, but that's community. This felt like a safe space for people to ask questions in ways in which they would never ask people who they've known for 15 years, right? But they were willing to ask it there, right? So community is important. Safe community is important. And community can also include medical providers, right? And that is medical providers who have trades in medicine. That could be holistic providers.
Mm-hmm.
So I always recommend that
Yes.
people also access various forms of care. But I also recognize that where we are, healthcare does feel more like a privilege than a right. So accessing those things, right, that's a whole other conversation, right, for us. But having multiple types of care providers, right, and letting each of your care providers know what is going on, right. So I'm a mental health therapist, but I'm asking about what's going on with you physically. I'm asking about your vitamin D. I'm asking about your cycle. I'm asking about all these things because that informs what we are doing, right? So having multiple medical providers knowing all parts of your story, right? Unfortunately, when you're working with some medical providers, they only want to talk to you about your bad knee. I don't want to know what's going on with your hormones. But guess what? If a drop in my hormones is affecting my bone density, sir, that's your
That's
business
your
to know
business.
what's going on with my hormones. And how dare you not ask me what's going on with my hormones? If I
And I really, guys, I just
if
want
I
you to
break
hear
my
this.
knee and I'm 47, you need to be asking me about my cycles.
I need you to hear what Dr. Abrams is saying right now. Like, this is so important as far as I'm concerned, right? Like, please get with some practitioners that know what the hell they are doing. And I personally subscribe to functional
Yeah,
medicine, full stop.
I go to
I
Stat
was
Wellness right over there on Howell Mill. So
I go to
yes,
Progressive Medical,
who
and I found a way. People complained, but guess what? I found a way in there, and I get what I need. I'm there every week getting infusions and all this other business. I believe in naturopathy. Okay, I'm
Yep.
there for it. All
Yep.
the things, right? Conventional medicine gets me when I need a lot of blood work done
Yep.
that the functional people told me that I need. Okay,
Mm-hmm.
and if I need something immediate, like I have to get a 2D breast, a mammogram,
Yep.
right?
Yep.
Fine,
Mm-hmm.
right?
Mm-hmm.
But
I
I'm
put
gonna
my
pull
care
up.
team together. I go to my OBGYN for my pap
Correct,
smears, my mammogram, that kind of stuff.
correct,
I go to functional medicine because we're looking at my hormones and my PCOS and my fibroids.
and correct. I mean,
Right?
that's so you guys really lock in what's being said here, right?
Mm-hmm.
And I will also say this, and I've said it a million times.
Mm.
We spend money on far less,
We sure do.
right? And I'll be very transparent with you. I mean, I've let some vacations go, a lot of
Mm-hmm.
extras go, because I put a lot of money, and I
Mm-hmm.
don't mean brand, a lot of money into um into my wellness, right? And ensuring that I can operate optimally, and I'm still doing it. And it's a choice. I'd rather live well at 75 with no assistance, okay, than take a vacation to Greece. That's me.
Yep. And getting out of the mindset that it's got to be one or the other.
Well, correct. But
Right?
for
Yeah.
me, it
Yeah, not
felt
for you, but
urgent.
just in general. Yeah.
Right,
Mm-hmm.
exactly. Because you can do both, right? But I felt like at the time, I needed to focus,
Yep.
right? And I didn't want to be in another place, right? So I feel like, yes, Belle, it's like health is wealth, literally. And I know it sounds cliche-ish, but I feel like we need, especially as Black women, we need to lock in better, right? Lock in more to what's happening from a health and wellness perspective. And we're not talking about whether or not you have six-pack abs. I'm talking, as Dr. Sheila, my favorite, and y'all will meet Dr. Sheila at Elevate Pause. Dr. Sheila says you need to be focusing on whether or not you're going to be able to get up off that toilet.
Yep. I talk to clients all the time about, yeah, you can go on these vacations, but if you're so unwell, you're spending the vacation sleep and like triggered the whole time, and like you can't even really access this. You spent all this money to go to Costa Rica and you're tired the whole time. This is off. You're irritable. You yelling at your kids. You yelling at your partner. You yelling at your friends. It was an awful trip. You ain't got no money. Like, but you made it to the vacation. But like,
Yeah.
for what?
Yeah, we just need to do better. We need to do better on that. And we need to invest in our mental wellness. All right. I mean, we have here. So Dr. Abrams, tell everybody how they can get with you. I might put your cell phone number on wait.
You can get to me. I don't know if you can get into my office because I am booked and busy these days, but I always give referrals. But yes, the name of my practice,
Wait, what
I
did
am
you just
based.
say? What did you just say?
I'm full.
You, does that mean you're not taking new patients?
Not right now. Possibly top of the year, but I am over full.
What?
Busy Black girl
Amen. Well,
syndrome.
amen.
Booked and blessed, right? But we have a lot of clients. I probably have too many. I probably have too many right now, but I always give referrals to clinicians who work like me, who have openings, and right. I am oftentimes
That are like
that
you
are
practitioners.
similar training, similar but because I also do long-term work, my practice tends to be a bit full because I do trauma-focused work, so I have clients for years and years. But the name of my practice is Essential Behavioral Health. I am based in Atlanta, Georgia, but I have a telehealth practice, and I am authorized to practice in 42 states. So I can I can practice interstate. Obviously, my name on here is Dr. underscore Ayanna underscore A. I work with individuals. I work with, I run groups, and I have a specialty in couple therapy. So about half my practice is working with um, couples, and I do corporate consultation and wellness, kind of the same way you met me on Sunday. I'm in these streets talking about all the different things, more specifically related to Black women's mental health and related to romantic couple wellness, as well as a specialty in friendships between women.
So this is our person. So what she's saying is that she can't see us today, but what she is saying is that she will get you referral to somebody. Right, only 42 states. Thank you, Venti Morgan. Right, exactly. That's exactly what I was thinking.
I'm
So
trying
she will get you the
to be here
referral.
for the people. Just trying to be here for the people.
Well, I might have to buy my way in. Look. because I'm all about showing it. Look, I'll buy my way in because money talks. Look, I need what I need. If you know me, you know that this is very true. I want what I want. When I lock in, I lock in.
I don't have a book. I don't have a book yet. I got books in me. I don't have a book yet because when I'm gonna write a book when I'm seeing clients in 42 states. This is me working on my own boundaries, and I specialize in boundaries for Black women, but I also need to practice what I preach.
So I feel like I just feel like I need to talk to you once a month. So there's a few people that I've had on that I like every month. I feel like you need to be giving us the business, especially as we get closer to the holidays, because it gets very thick.
Let's set it up.
All right, y'all. So we've had the best of the best. Yes. I want to say this. Thank you so much, Dr. Abrams. I appreciate you honoring this. I mean, we just met on Sunday physically.
We were supposed to meet on Sunday. We were supposed to meet on Sunday.
I saw how I was sitting right in her face, and I was like, oh, my God. I'm going to chase this woman down in here because I need to talk to her immediately. I was like, do not move, do not move, do not move. I need you. Yeah? So I appreciate you guys. Maybe I can convince you to be at Elevate Pause. Guys, you know, Elevate Pause is happening on
the 16th. We will, let's talk offline about that, but yes.
So tickets are still available. Go over. We've got the best of the best, but I'm trying to convince this one to give us a few minutes. Maybe. But boundaries. I'll accept the boundaries. I won't push. The
book is coming one of these years after I read all these books. But yes, the book is coming. But I have programs that will be coming back out about boundaries for Black women, and my page talks about boundaries for Black women quite often. So
thank you. I appreciate you. It seems like everybody else appreciates you as well. And
I'm glad we got this together.
And we will be talking soon. Yes,
absolutely. I'm so happy that Sunday happened.
Thank you.
Have a wonderful night.
Dr. Abrams, thank you so much. You have a great evening. And guys, we'll see you next week.
Okay.
Not with Dr. Abrams, though, but we'll see you next week.
Bye.
Bye.